In today's Health Watch, emerging research is finding that lifestyle changes could help to reduce a very common medical condition affecting tens of millions of American women. You heard of this? Uterine fibroids. They are non-cancerous tumors and impact up to 80% of women by the time we turn 50.
Wow.
They can have wow is right, Nate. I said the same thing. They can have life-altering symptoms and some complications. Fibroids can cause pain, heavy menstrual cycles, that is never fun, and in severe cases, anemia. July is Fibroid Awareness Month. We're happy to say that Dr. Tara Shirazian, director of NYU's Langone Center for Fibroid Care, and joins us to fill us in. I was, just like Nate said, wow, when I heard that figure too, 80%, I think it's so much more common than people realize.
Yes, it's extremely common, 80% of all women. And I think what people don't know is that not only is it common, but it's also chronic and it's also recurrent. So a lot of people think of fibroids as a one and done kind of thing. We'll take out our fibroids and everything is fine. But in fact, they come back in 60 to 70% of younger women especially.
And also I've seen that, I've heard that they can get so large sometimes that people think you're pregnant.
Yes.
That was a surprise to me. I had a friend that said hers was the size of a watermelon, and she was not a big person.
Right. They can make you look pregnant, they can grow quite large, they can necessitate really big surgery, they can cause anemia, fatigue, they don't let you live your best life. People
Caused
don't
by
go
what,
out.
Tara?
Well, because fibroids are masses, they're inflammatory masses of the uterus. So they can bleed, but they can also create a lot of just local inflammation, so creating pain, fatigue, debilitating symptoms around the periods. So many women suffer, and they suffer in silence because they think, oh, I'm meant to have a bad period. I'm supposed to be suffering monthly. And so often they delay care and treatment for the fibroid.
What are these lifestyle changes that could potentially prevent or reduce the risk?
Yes, so I'm so glad you asked
Look how
about
you're
that.
clapping your hands.
I know,
You're like,
because
oh God, I can't wait to
talking
answer
about
this
it.
question.
Yes. Well, because, so for many years, women would come to my office and say, well, what can I do? So I understand I have fibroids, I need a surgery, but then what can I do to prevent them from coming back? Or what can I do to prevent them from growing? So we started studying lifestyle change. We started studying vitamin D because there's a lot of research around vitamin D deficiency and fibroid growth.
So you should take vitamin D.
You should take vitamin D. You want normal vitamin D levels. You want diets that are anti-inflammatory. You want lots of vegetables, 5 servings a day. You want to be exercising because weight can increase the growth rate of fibroids because it produces estrogen that feeds them. So there are a lot of lifestyle changes that you can make that actually can empower you to have better quality of life, and that's what our study showed.
And when in the study, how did these lifestyle modifications help these women?
Yes, so we built in a whole program after surgery. We said, okay, you had a surgery, now we're gonna try and prevent new growth with this lifestyle program. We call it the LIFE program. And the intervention was meant to reduce the regrowth of fibroids.
Right.
So they did exercise, they met with our nutritionist, we did vitamin D, we followed their lab values, we followed ultrasounds to make sure new fibroids weren't growing, and we just tried to stay ahead of new growth. And the quality of life measures for our patients increased in a statistically significant way throughout the study. So women were doing really well on it. They were very motivated.
Of course.
It was a small group, so that limits the study, but
Lupita Nyong'o just recently went public with her fibroid battle. Venus Williams, you're Venus's doctor. That's not telling tales out of school. That's public knowledge. Venus Williams has also talked about it. And it seems to be, I've heard that it's more common in Black women.
Yes.
Why is that?
Well, there's definitely racial disparity in fibroid disease, as we say. So 80% of all women across all races have fibroids, but then 70% of that group are Black women.
Wow.
So, and we think it's genetic. We think if you have a family history of fibroids and your mom or sister or aunts had fibroids, likely you will develop fibroids. So that's a key group that we should intervene in terms of prevention. Really thinking early about care for those women.
Are there diet supplements we can take? You talked about the diet we should be following.
Yes.
5 vegetables a day. That's tough.
5 servings is really tough.
5 servings for me, but is there a diet supplement or something?
Well, vitamin D,
Vitamin D,
said,
okay.
and vitamin D and green tea extract, which is out there already in a combined vitamin that's been studied.
All
and
right.
turmeric is good too. We think there's a lot of anti.
Valuable information. Dr. Shirazian, thank you so much. We appreciate you.